Welcome to the Men's ADHD Support Group featuring Dr. Bill Dodson. Dr. Dodson is a board-certified adult psychiatrist who has specialized in adults with ADHD for the last 25 years. This guy knows his shit. So I really want everybody to have fun. Remember the speaking rules as far as the presentation is concerned. We're going to be talking about ADHD and the Owner's Manual for us and what that looks like. So without further ado, Dr. Dodson, go ahead and take it away, sir.
Good afternoon, good evening, wherever you are. This is the third of a series, and it picks up where the other two left off. And it's once you got the diagnosis, what do you do with it? Just a standard disclaimer. This is not giving medical advice. It is for strictly educational purposes only. Nothing that's going to be presented today is going to be a substitute for the relationship you have with your clinician. That's where all the action takes place. The views that I'm going to express are my own. They are not necessarily representative of the Men's ADHD Support Group. So what are we going to talk about? What we're not going to talk about today is medications. That's in the first video of this series. So if you want to know about that, that's where to look for it. Now, we're going to talk about why the non-medication based therapies have struggled. Really struggled to show any effectiveness even when everyone expected them to work. Now we're going to talk about coaching and the very specialized skills that work for people with ADHD when the usual neurotypical skills don't work at all. And we're going to talk about how to repair the damage that was done by life experiences prior to you getting the diagnosis and understanding what the hell was going on. So there have been 54 studies of non-medication based therapies for treatment of ADHD. And all 52 of them, all but one, there's one study that shows pretty good response to exercise, but all the other ones have failed to detect any lasting benefits for the core symptoms of ADHD. In other words, the symptoms that make ADHD. And those four are distractibility or poor attention, impulsivity, both action and emotional expression, hyperactivity in kids, where kids are in constant motion, fidgeting, that tends to tone down in adolescence and go inside and be experienced as hyperarousal. And everywhere except the United States, they've added troubles with controlling the expression of emotions. The United States is still 20 years behind everybody else. Things got so bad that back in 2007, so it's 17 years ago, they dropped the recommendation for multimodal therapy, which had been the recommendation up until then. And multimodal really meant you have to do more than just take medication. That was changed in the American Academy of Child and Adolescent Psychiatry's practice manual. And they changed number 10, which was called the multimodal therapy recommendation, to state if a patient has robust response to psychopharmacological treatment, then psychopharmacological treatment alone is satisfactory. Well, they basically said that they could not in good conscience recommend therapies that they knew before didn't work or add anything to medication. Now, these therapies did have some, quote, non-specific benefits that were situationally bound. In other words, as long as the person was in a highly structured environment, you could see some benefits, but quite literally, they could walk out into the hall and all the benefits were gone. Why weren't the therapies working? And you think this question would have been asked a long time ago, but it wasn't. All of these approaches, all these older approaches that didn't work, took a very specific view that people with ADHD were actually neurotypical individuals. They were like everybody else, but they were damaged or broken. They were deficit in some way. The theory that's dominated the field for the last 20 years is the executive function deficit theory. And that the goal of therapy was to change people with ADHD to be neurotypical, or in their words, normal. The proponents of these interventions apparently weren't aware and didn't want to be aware of how hostile, shaming, and incorrect this was. I mean, most of the people here are good, normal individuals. And if we try something once or twice and it's holy failure, we're going to drop back and say, I'm missing something huge and fundamental here. No, we've been through 52 failed studies and we're raising money for the 53rd failed study as we speak. The whole concept that we'll talk about today, that some people are neurologically wired differently and are therefore neurodiverse. Something that's actually very new, maybe 4 or 5 years old. And so it's a new idea that you will not see a great deal about in the literature. Attention in ADHD is not inconsistent, but it's inconsistent in a very consistent way. Now, just about everybody who's on this broadcast knows that 3 or 4 times every day you will get in the zone. It's slang here in Denver. It's getting the flow on the East Coast of the United States. And on the West Coast, it's getting the groove, but it's all the same thing. People get deeply involved. That can be in a hyper focus and have no impairments at all. Because people that function, people with ADHD can function at a very high level, sometimes but not others, have led to accusations that people are doing this to be willful or to be rebellious and fine, when this is not at all the case. So we have to start asking the right questions, which has not been done up until now. So the first thing I always ask is look back over your entire life. If you've been able to get engaged and stay engaged with literally any task of your life, have you ever found anything you could not do? Now, this is the reverse of the usual question where until now, research has only asked about the things that people with ADHD have struggles with. Most people will think for a while, look back over their life and say, no, if I can get started, and if I can stay in the flow, I found I can do just about anything I try. So this is the recognition that people with ADHD are situationally bound. There's sometimes when they can have perfect, complete attention, and sometimes in which they're often la la land. When they're in a hyper focus, they can do anything. They're what's referred to as being omnipotential. They can do anything. I use this as an example. This is the same person, same college student. On the left-hand side, he's watching a math video. On the right-hand side, he's watching Star Wars. And what you see is when he's watching something that he's interested in, he's not hyperactive, he's focused, he's engaged. When he's watching something that's boring him to death, he's quite hyperactive and not engaged at all. That's question number 2 is, if I can do anything, as long as I can stay engaged, how do I get engaged and stay engaged in the first place? This requires that we look at ADHD in a totally different way than it's ever been looked at before. That the impairments of ADHD depend on the situation that you're in that moment. ADHD is actually a problem of consistent access to your abilities on demand as the situation demands. And therefore, if you can do anything in the right situation, this is not a disorder. Again, most people with ADHD are omnipotential. The way I look at it is that ADHD is actually a second nervous system. It works perfectly well. If it's more perfect, because sometimes it lacks nothing. But it works by its own set of rules, principles, methods, techniques, whatever you want to say. And that the more typical access doesn't really work well at all. So a functional description of ADHD is that it's a genetic, neurologic, brain-based condition. In other words, this is not a function of willpower. It's not a function of good or bad parenting. It is something that you are born with. And it's a difficulty with engagement as the situation demands. And it's not just performance. It tends to be, especially in the first sessions, oh, we really focus on is how are you performing in work, in your social life, and that sort of thing. Your nervous system is a package deal. It's everything that you are. It's your mood, it's your energy level, it's your outlook on life. So I will generally ask people, what do you like when you're not engaged, when you're good and thoroughly bored? And what most people will say is, one, I've got no energy at all. I'm just a blob. But I'm also just incredibly irritable. I want to sit there on the couch, not have anybody mess with me. And I'm really down on myself. I'm down on everybody else. My future holds nothing that I want any part of. But everybody's also had 1,000 experiences that tell them that just the instant they get engaged in something that is interesting, challenging, novel, urgent, or that they feel passionately about. Now, we use the acronym NICA to help us remember those 5 things. When they're able to get engaged, suddenly their mood is great, their energy is great, they're gregarious. Let's go do something new and fun and interesting. So it's not just your performance, it's everything. It's your energy level, it's your mood, it's your outlook on life is dependent almost entirely upon your ability to get in the zone through these 5 mechanisms. Now, these are very personal and subjective features. They're going to be unique to you and unique to the moment. Things which are interesting today or challenging today may not be interesting and challenging next week, especially if you've overcome and mastered that challenge. A person with an interest-based nervous system must be personally interested, challenged, find it novel, or urgent right now, or nothing happens. This is the whole basis of procrastination. You haven't been able to get engaged and get started because you haven't found that people to get access to your abilities. Now, the other 90% of people out there in the world are wired entirely differently. Now, everybody looks the same, but neurologically, they don't touch at any point. And neurotypical people get engaged based on 2 factors. The big one is the importance of the task. And the second one is that there's a reward for doing the task or a consequence if you don't do it. Consequently, people who have a system that works on importance have a number of advantages over people who have an ADHD style nervous system. The big one is that ADHD has to be personally interesting, challenging, novel, urgent, whereas for people who are neurotypical, the tasks don't have to be important to them as an individual. It can be important to their boss, to their teacher, to their spouse, to their parent. It can be important to something abstract like their future, their future gains. And don't have to be important right now. People who are neurotypical can arrange important things in order of importance. In other words, they're able to prioritize. And this helps the individual engage as the situation demands, get access to their intellectual abilities every time they're needed, and then stay engaged with the task all the way to the payoff. People with an ADHD nervous system, I'm sad to say, don't fit in a neurotypical world. If you look at schools, every school you'll ever see works on not just importance, which people with ADHD don't do well. It's worse than that. It's secondhand importance. What does somebody else, the teacher, think is important enough to teach, important enough to put on the test, because it's going to be important that you know it, when you go to the next class next year and when you go out into the world of work 10 years from now. 90% of jobs are also based on secondhand importance. What is it that somebody else, your boss, thinks it's important enough to them that they're willing to pay you to do it for them? And so you must use the boss's sense of importance or urgency to get yourself moving. Now, consequently, people who have an ADHD style interest-based nervous system don't fit well in an importance-based world. This, by the way, is the beginning of the imposter syndrome, where you have to act as if you are different from the way you really are. The weakness of an ADHD style nervous system, again, is that things which are challenging or interesting today are not, uh, helpful to you in getting engaged once they've been met and mastered. Newness is time limited. Everything becomes old hot after a while. People who have an ADHD nervous system, urgency is their substitute for improvements. And so that's why people with ADHD procrastinate, unable to get engaged until they get that urgency, which they can substitute for importance and usually, but not always, get engaged and get stuff done. You'll find that sometimes people will create crises or chaos to help them get engaged, and they found that they function and produce much better. This can be mistaken, for a borderline personality disorder, which again is not exactly a compliment. And this brings us to the next basic question that you'll recognize as actually being a foundation, one of the several foundations of coaching. And the question is, how do I learn to get in the zone when I want to and need to? In my practice, we have what we call an ADHD Owners Manual. Basically, the idea was that people with ADHD nervous systems were given the wrong owner's manual for the maintenance and function of their interest-based nervous system. They were given a manual that worked perfectly fine for people with a neurotypical nervous system, but which didn't work at all for them. And so this focuses on how and when a person with an ADHD nervous system does particularly well. It's not going to look, as most of the therapies have thus far, at what goes wrong and then demand that you do it. It's going to be highly personal to you and highly individualized. There are no two people that are the same. We tried to do a one size fits all owner's manual and found that it was impossible. You'll also find that the manual changes over time. The techniques that work for you when you are 8 are not going to work when you're 28 or 48. The techniques are not going to work forever. They're going to work for a month or two, and then get old fat. And you'll have to use other techniques until the original technique seems fresh again. Over a lifetime, the majority of people are going to need about 60 techniques in their manual. This isn't as hard as it may sound. Usually by the end of a month, most people have 25 or 30 already. The manual is a written record of when things go spectacularly well so that you can do them again. I emphasize the word written because do not kid yourself that you're going to remember what you need to know in the heat of the moment. Write them down so that you don't forget any or overlook any. So again, the owner's manual is not a neurotypical owner's manual that's bound to fail. So I want to give you a couple of examples because it's not exactly obvious what I'm talking about here of things that work particularly well for people with interest-based nervous systems. We're going to do 7 of them, but again, as you might imagine, there's as many as there are people. The first one is the one that is most often found in business. In fact, I haven't found somebody who's successful in business who has not done this to some extent. People with ADHD are idea people. They're the big problem solvers. They are not the ones that then go and implement those solutions. People with ADHD, it's well established in the research, are world-class intuitive problem solvers. The technical term that you'll see bandied about is that they have cognitive dynamism, but that doesn't do it justice in the slightest. The problem is that once problems are solved, they have no more interest or challenge or novelty, and the person loses interest. Most people with ADHD have a lot of half-finished projects sitting around the home and office. So the best solution is to find someone with whom you have a very good mental map, but who would never come up with the great ideas and inventions and solutions but if shown what to do, will implement it on a world-class basis. You have to be partners with these people because both of you have to realize that without your partner, both of you would probably starve. In academia, the technique that works is a variation on that idea, and it's called body doubling. And it's using another person's ability to get engaged, usually a neurotypical person, to get involved yourself. This is, if you remember back in college, these were study buddies. Uh, they allow you to sort of piggyback on their ability to engage on demand. And it's by far the most successful academic technique. My daughter just hated math, but she had to take it in high school. And so after dinner, I would sit down at the dinner table. I would get her started through the first two or three problems, and I would go and start washing the dishes. And after about 10 or 15 minutes, I would hear this grumbling from across the room that her teacher was the spawn of Satan. And I knew it was time to go back, get re-engaged, help her get re-engaged so that she could finish her mathematics homework. Challenges and competition are very highly usable. Competition usually brings forth our very best effort. It makes people driven. It adds that quality to any endeavor. This can also be something like proving a detractor wrong, brings an extra and also much longer time of engagement and effort. The example I give is somebody who says, "Oh, you can't do that." If there's a voice inside your head that says, "Oh, yeah, laughing." I don't care what that task was. If you accepted that challenge, you will master that task the same day. Um, there's also that part of people who said, "I'll show you never to underestimate me again." Many people will also use the notion of social justice or even rebellion against the system that keeps people down. And it can bring special, sustained effort when simple competitiveness is not able to give. Planning for deadlines. For a lot of people, they just cannot overcome procrastination. And they know that no matter how many techniques they try, they're going to wait until the bleeding deadline to get started on a project. Now, usually, unfortunately, not always, they are able to then get engaged and turn out a huge amount of high quality work in a very short period of time. Or if you know that you're going to wait till the last minute, if you know what's going to happen, plan for it. Make sure that nothing else is going to compete for that time. Tell the people that you are around that you're going to be far away and can't be contacted, where they will not try and find you. The example I give is of a law professor locally who made most of his income not from his job as a law professor, but from writing commentaries on the law. And he said, "I'm going to have to stop it because it's ruining my life. I have one due every 6 months, and I tell people I can't go skiing, I can't go out and have fun on the weekend because I'm going to be working on my writing." And he says, "I never do. I can sit there with a pad of paper for a whole weekend and not write a word. And invariably I'll get in a hyper focus and write the whole thing right straight through." I said, "Great, let's just plan on it." And so now he tells everybody that he's going to be in Romania. People will not try and find you if they think you're in Romania. His wife goes home to visit her mother, and he now has a legal secretary who actually does the typing, and all he has to do is dictate it. So he still gets a hyper focus right at the very end, dictates it right straight through verbatim, and then takes the rest of the week off just to sort of recuperate. But now for the other 5 months and 3 weeks, he has a good time. He may make himself some notes and things like that, but he doesn't let it ruin his life and he doesn't feel guilty about it anymore. A lot of people find that they have to inject interest. Life in and of itself, and most jobs are not intrinsically interesting or challenging. Most jobs are repetitive and challenging, and basically you're doing what the boss wants you to do, and the boss is willing to pay you to do. And so many people with ADHD struggle to get engaged and stay engaged. And so it is your job. Nobody's going to do it for you. It's your lifelong job to manage your engagement with the tasks of life that you don't find interesting, but somebody else very definitely feels is important. So know your personal passions and motivators so you can get yourself engaged. People with ADHD have magnificent imaginations, technicolor imaginations. And so they're able to create in their imagination situations of novelty, interest, challenge, urgency, and passion. The example I give is a colleague of mine who was flunking out of med school in his first year because he was bored to death with gross anatomy. And luckily, he had a teacher who figured out that the problem was he was just bored. And he said, let's see if we can liven it up. And what one of the things they decided to do was that one of his real idols when he was growing up was John Kennedy, and it really tore him apart when Kennedy was assassinated. So he imagined that he was an emergency room physician at a Dallas hospital and had just wheeled in John Kennedy on a gurney with a bullet wound to his neck. Studying the anatomy of the neck at the time, and he had to know the anatomy of the neck whole in order to save Kennedy's life. Well, with this, he went from practically flunking out to ultimately graduating number 2 in his class. Again, because he intuitively understood that he had to have dozens of techniques like that to help him get engaged. He did all this, by the way, without medication. Sometimes you can trade importance for that which is interesting to you. It's important maybe that the tasks get done, but not necessarily by you. So there are many different ways to do this. You find other ways to attain the end goal. You make a deal with the boss or the teacher or whoever that you, as long as you attain the goal they want, how you do it doesn't really matter. You trade that which is important for that which is interesting. The example I give is of a woman for whom it was very important to have a clean house and nutritious meals on the table, but she hated it. It was boring, it was repetitive. Well, she was a talented seamstress, so she traded off to the other mothers in the neighborhood that she would do sewing for them, dresses, drapery, slip covers. Well, right now she's in the midst of doing her bridal gowns. The whole time that she was working on things that she found very artistic and stimulating, those mothers were in her home cooking, cleaning, you know, food freezer was blocked off breakfast, lunch, and dinner, and all she had to do was throw something in the microwave. You also have to distinguish between wanting the process, and you have to distinguish that from wanting the outcome. Someone asked Norman Mailer, why do so many people want to write a book, and yet they never do, and yet you're able to knock out a new book every couple of years? And he said, what the problem is that most people want to have written a book. He said, I actually like writing books. So if what you really want is the outcome, not the actual process of doing it, farm it out, because you're not going to do a good job and you're going to hate every minute. So once you've learned how to turn on your nervous system at will, now it's time for therapy. Now you've gotten on the very best medication for you, and it's been optimized to you in terms of the right molecule, the right dose, and the right timing of those. And what this has done has leveled the neurologic playing field for the first time. Your attention, your impulsivity, your sense of internal arousal, and your emotional control is the same as everybody else, no better, but also no worse. You've also learned how to manage your unique nervous system that works on interest. And you've learned that you need to figure out who you really are and what you are really capable of doing now that you know the rules. You need to suspend judgment on what you think is possible for you. You need to go ahead and push the envelope to discover yourself without ADHD getting in your way. I think you're going to be very pleased with what you discover. You then need to start that lifelong process of writing your own personal owner's manual so that you can get engaged and get access to your talents and abilities on demand. Now it's time to go back and repair the damage that was done before you got diagnosed and before you figured out what the heck was going on. You'll also find that the therapies that failed completely before will now work well. So basic question number 4, how and where did you learn what you know about your work, about how to relate to other people, about how to be a good person and lead a good life, and about how to be proud of who you've made yourself into? Most people, when you ask them that question, how and where did you learn what you know about life? Most people with ADHD will answer after a while with some form of what I know, I taught myself almost entirely. What they know is that they really didn't have any mentor. They had no one to guide them. They had to do everything on their own. Um, they got very little out of school, but they didn't get themselves. They had sat through the lecture, read the book, where they went back to the dorm, learned it in their own unique way, and then put it back together in a neurotypical way so that they could put it on the test. The things that they saw in other people whom they admired, they studied deeply, and they made that a part of themselves. Most people with ADHD are self-made people. And so you can be proud of that. You need to start by remembering that you are a survivor. You've been able to do it all on your own. You've had to overcome more than anybody else. You've had to work twice as hard for half as much. So you need to give yourself credit for that. A lot of people tend to only look at their shortcomings and not the things that they were able to do, which were utterly amazing. You also have to remember that you deserve all of the credit for having made it this far. Most people do not have mentors or guides. They had to do it on their own. So you can be very proud of yourself for what you've done. You can also stand back and look at all the negative self-talk that has stopped you before, and started to be a part of you. And it's just became so familiar that it became a habit. That habit now can be changed. You have to recognize that this negative self-talk is not you. It came from somewhere else, and you internalized it. So you have to make it your enemy and get rid of it. Now you have realistic hope for getting in charge of your life and your emotions. All the pieces are in place. So you need to now go back and work forward the past. You have to sort of do an inventory of what's working for you, but also what's not. What do you want to be when you grow up? What are your goals? What do you really care about? What gives your life meaning? You also have to learn how to deal with a traumatic past. That was then, this is now. So one of the things that you would be looking for, probably, is a psychotherapist who is trained in trauma-informed psychotherapy. You also have to come to realize a way, find a way, be reliable and loving to the other people in your life when you get nothing out of it, when you're being altruistic and caring about other people. And you're caring about them, help you establish good, lasting, beautiful relationships. You also need to discover what you care about passionately. That's the fifth way of getting into the zone, and probably the best and most long-lasting. It's what gives your life meaning. And finally, if you have children, you can now be a better parent so that your kids don't have to struggle with what you went through. So at this point, we'll stop and open things up for questions and discussions. Thank you very much for listening.
Excellent. Thank you so much for that. I find it hilarious because when you say you were talking about the rebellious part and everything like that, and some of y'all are going to know the reference, some may not. When we think about bands like Rage Against the Machine or Green Day and the lead singers of those bands, right? Like some of that music, whenever I listen to it, I'm going, oh, And that's one of those things. I have this working playlist that's just nothing but like punk rock bands and stuff like that from the 90s and double aughts. And I always wondered why did that stuff resonate so much with me? And I then I look at like the histories of these different singers and the different people who are out there, like Zach De La Rocha from the Rage Against the Machine and Billy, I can't think of his name, from Green Day, and all those different singers that when we look back, we're like a lot of those lyrics really resonate with the struggles that we have with ADHD.
Yeah.
And
Now, if you look at the people who have changed the world as we know it, people with ADHD are heavily overrepresented in that group of real world changers.
So this time is where we're going to open up the floor to questions or comments. Please make sure to use your hand to raise it, and so that you have it. If you want to use the chat feature over to the side. Thank you, Billy Joe Armstrong. Thank you, Jed. Feel free to ask the questions that you have. We're going to start with Amin. What question did you have?
Hi, William. Hi, Shane. Can you guys hear me okay?
Yep, sure can.
Yeah, perfect. Yeah, I've actually typed the question up, but I will read it out as well. So I'm a classic ADHD problem solver. How do I find and implement a finisher partner? What qualities shall I look for in a potential partner, and where do I find them? Before you answer the question, I'd just like to thank you immensely. I found quite a lot of validation in everything you say, and it's provided me with hope and inspiration. Thank you so much.
The first thing to look for a partner, a business partner, um, as being a couple, being a parent, whoever, is somebody who likes you just the way you are. They don't want to change you into being a version of them. That is not going to work. It is fundamentally hostile, who you are. When somebody starts in with wanting to change you, what they're saying is, I really don't like the way you are. I don't like who you are. In order for us to get along together, you're going to have to be somebody that I want you to be. First of all, that's neurologically impossible. So you're being set up for failure. It's hostile. It also shows that you really don't want to put any effort into knowing who you are, what your strengths are, what special things you have to bring to the relationship. So that would be the very first thing I would look for. Somebody who likes you just the way you are. You also need to look for somebody who at the same time will support and encourage your growth. But it's the growth that you choose. It's the goals that you choose to pursue, not the ways they want to change you. So they have to be supportive. It's like the cheerleader, good person who says, we see you as a good person who is very capable, very smart, hardworking, with relentless determination, who has tremendous strengths that have gotten you this far. And I'm here to help you in any way I can to achieve your goals. Those would be the things I would look for. And if those weren't there right up front,
Yeah, I mean, I'm gonna kind of hop on this one as well. I was a project manager for 15 years. And as a project manager, one of my biggest things was I would struggle at, long-term projects where you go in, you create the process, do the testing, and then maintenance for a few months. And I started recognizing that I was really good at about 80% of project management. What I wasn't good at was that maintain part. The second it got boring, the second it got away from the creative aspect or the development aspect, I was out. I just checked out. And then, of course, my work ethic would kind of tank. And what I would wound up having to do is going into companies where I would literally sit here and say, this is my process. I need to be able to train your people to maintain and take this off my hands once I get to this point. I am a creative project manager. That's my skill set. And the other one, it was I'm horrible with budgets. money and time and stuff like that. I already struggle with time, so I have to do things a little bit differently. But adding on top of that, tracking money and things of that nature, I wasn't good at. And so I had to find somebody. There had to be a part of my subject matter experts needed to be a budget person who could make decisions. And that's where my success was when I would go to work for a company and they would provide a budget person and they would provide a team of people who would maintain the project moving forward. And then I just focused on short-term contracts from 3 to 8 months out of the year. And then I would take 4 months of a year off, 3 to 4 months of a year off so that I could just kind of decompress and recover. Now, I had the privilege to do that. But at the same time, the point that I'm trying to make is develop and understand your strengths, your work style, your relationship style, develop and understand a concept of what kind of business that you want to run or something like that, and figure out where you can fill those gaps with people in your relationship with your friends and stuff like that. Develop friendships who help build you up by filling in those gaps. And like Dr. Dodson said, they're there for you and they accept you for who you are.
Yeah. One of the things to avoid in business and jobs is immediate supervisors who are micromanagers. They want you have to be an extension of them. They don't play to your strengths. Mag out of that real quickly. It's just deadly. There's a very good book called Clever, and the authors of it escape my mind right now, but it was the book of the year for the Harvard University Press back 7 or 8 years ago. And it's about managing the clever problem-solving people who save any business. There's going to be 5% of people who come up with new ideas, the new initiatives, and keep a business or any organization vital and alive. And then the other 90% of people who maintain it, who are the grunts who basically keep the going. And their description of clever employee is the best description of an adult with ADHD I've ever seen. And so the book is actually written for that first and second line manager about how to manage these thoroughbreds, as they refer to them, without which a business will absolutely collapse and fail. But these are the people you have to keep, make happy in order for any business to do well. So it's a very good book. You can read it in an evening or two.
What's the book called, sorry?
Gordon?
What was the book called? Yeah.
Clever. I just posted the link in the chat to the side.
Shane can find anything on the internet in a matter of seconds.
I'm pretty good. I'm pretty good at what I do.
That's something I can't do.
So any other questions or anything like that, feel free to raise hand or add them to the thing. Dr. Dodson, whenever you are dealing with like creating that owner's manual, how do you suggest people, and you kind of touched on it in the slides, but how do you suggest that people just start that process? Like, because my to-do list literally is 5 pages of notes of stuff like that, like, I just have to go and figure out, like, when do I do those things, right? And, like, prioritization has always been a struggle for me, even as a project manager. Like, how do you get started figuring out how to prioritize with time being such an issue for us?
Well, first of all, you have to recognize that prioritization, is going to be a weakness for everybody with ADHD because it's entirely importance-based. It's arranging things in order of importance with the idea that the most important thing should come first, and we should get engaged with that because it's important. As everybody with ADHD has found, that doesn't work. So you have to find other ways of gauging what comes first. A lot of people will end up doing what they find interesting first. Well, unfortunately, most bosses don't go along with that. So again, it's finding how you get engaged. And it's going to be unique to you. And it is something that you have to discover. Again, you have to understand this whole notion of hyperfocus. where you do, and this happens, I think, with everybody with ADHD, where you do get in the zone, you do get engaged, and you see these extended glimpses of how creative and working and productive you can be. It's how do you repeat that? And so that's also why I say it's you when you're in the zone, you don't notice it. Now you and what you're doing becomes one. It's as you're coming out of the zone and you go, wow, I just got a day's worth of work done in about an hour. Again, stop right then and there. Don't put it on a to-do list because it won't get to done. Well, you have to stop right then and there and write it down for yourself.
All right.
And you have to carry it around with you. Okay, or when you're talking or something like that. So when you have a task that's important, really important, you can go through and say, okay, technique number 26 worked last time. I'm going to use technique 26 to get engaged, knock this out in a record time, then go have fun.
Yeah.
You reward yourself at the end for having done it.
Yeah. I appreciate that. Thank you very much. Andy, your hand was raised.
I honed in on what you were saying, Dr. Dodson, about do the most important thing first. But I also know as myself that a lot of times that most important thing isn't the most interesting thing. And we've kind of got a saying in the group, and my friend Jonathan started it about eat the frog. When you get up in the morning, just go ahead and get that out of the way. Eat the frog, even though you might not want to. So I find that when I place the most important task first, and it's something that I really don't want to do, but then when I've got it passed, everything else is so much easier because I've got the part I don't like done already.
That would be a technique to go in your owner's manual, eating a frog. But I think you misheard me. It was important to them until the task is well worthless. It doesn't help people with ADHD get engaged. Most people with ADHD are able to honestly say, I have never in my life had an occasion where the importance of a task was anything more than it never has helped me. I've got to be really creative, really clever about how my nervous system works and on an excellent level, and not set myself up for failure by doing it in a neurotypical fashion. That's one of the hardest things for people to do is to give up on all those needs that are neurotypical that they see working for the other 90% of people and that they have devoted a lifetime of effort into making work. And it's one of the great disappointments that people have that you mean I'm never going to be neurotypical? No, you're not. You're going to have to play the cards that you've been dealt. You play them better than anybody else. And to be aware of those times when you are better than anybody else and reproduce them.
Andy, does that take care of your question or what you're talking about? Does that clear it up for you?
Yeah, was that
Oh,
all
absolutely.
Yeah. Okay.
Absolutely. Yeah.
And Dr. Dodson talks about this in another presentation. Y'all should really check those out. There's a lot of really good information in those other calls. But we have to get away from the thought of like of placing things in importance based, right? And getting away from time based stuff and getting into things like color coding the tasks that we want to get done, right?
Yeah.
Now, granted, mine is loosely based around time just because it helps me with that urgency factor. But like things that I know really need to get done are red. They're red on my to-do list. And that red means I don't have to sit here and go and try to figure out what's most important. I've already sat down and gone over that day and kind of figured out, okay, so anything that's in red, I need to have done in 2 days. I don't have when I'm going to do it. I don't have any of that stuff. I just have, okay, these needs to be done by 2 days. And then as I kind of move forward, as I've started building my owner's manual, I have an alarm that goes off at night about 8:30. Some of y'all have heard it. I have an alarm that goes off at 9:30 in the morning when I'm normally sitting at my desk, and they both tell me to look at my task list and my calendars for the next day. And that's how I start developing that habit over time. And of course, using an external tool like Alexa to tell me to do that. And then I just focus on colors. My brain responds to colors. And that's actually a pretty common ADHD trait instead of a timeline.
Colors and deadlines.
Yeah.
That's what it works. And but before we move
Oh,
on,
yeah.
one of my favorite channels on YouTube is How to ADHD by Dodson McCabe. And her newest video that was just posted this week was on time and the fact that the ADHD nervous system doesn't do time well. Most people with ADHD only have 2 times, now and not now. And so trying to arrange things in order of importance and in order of time or how long things will take, again, is setting you up to fail. So I would greatly recommend going to ADHD in their most recent posting on the time management.
Amin, you had a question, and then we're going to move on. Actually, Amin has 2 questions, so we'll get in there.
Okay, thank you for that. So in relation to my diagnosis, I've been diagnosed about 2 years ago. I've started concerting around 2 years ago. It's been immensely helpful in relation to the focus aspect of it. As you correctly mentioned, it's only once I am engaged and I've got a game plan, I can really hammer it out. However, I mean, currently in my personal life, I'm dealing with quite a traumatic situation. So currently I can no longer sleep at night without medical intervention. So I'm taking zolpidem to actually fall asleep. Now, this medication is not intended for long-term use. So I'm really not sure what I'm going to do in the near future when the medication runs out, for example. Immense anxiety takes over, turns into rumination cycles that lead to avoidance behavior, social media scrolling, or binge watching. So how can I now rescue myself from this pit of hell? On the one hand, I'm having immense sleep issues. On the other hand, I'm struggling with emotional regulation, and they both sort of go hand in hand. I do know that I've got immense attributes and good qualities and potential and, internal drive and all the rest of it. But I just need to sort of just get rid of this sort of bug, if you will, in my system and overcome it or bypass it somehow so that I can then get onto this trajectory in life.
This is very important, Dodson, because 90% of adolescents and adults with ADHD have an issue with insomnia. They spend more than 2 hours every night trying to shut off their brain and body to go to sleep. Their thoughts are bouncing or jumping from one thing to another, tossing and turning, kicking in bed. Nobody can stay in the same bed with them. Once they do fall asleep, if they wake up again, the whole thing starts all over again. And that goes till 4 a.m. when they go into the sleep of the their struggle to wake up in the morning. The technical term for this is chronic delayed sleep phase syndrome. And it's actually a very simple concept. A hyperactive component of ADHD is not the same at all points during the day. You may notice that as soon as the sun goes down, you get a burst of energy.
Yeah.
And it's usually, right as it gets dark, it's the best time of the whole day. What you're seeing is hyperactive, the energy component of ADHD, when it explodes on you, and as you try to get into bed at a reasonable hour, you're wired. Can't turn things off. So your insomnia is ADHD. It's caused by ADHD. It's just a poorly recognized manifestation of ADHD. So you've already pointed out that in medicine, the axiom is that it's always better to treat the cause of a symptom rather than merely suppress the symptom with zolpidem. Zolpidem is a perfectly good drug, but you're right, it is for short-term use. And it really suppresses the symptom. So what I ask you to do is, while you're on your concern, lie down one day when you can and take a nap on your medication in the afternoon. Now, what you know from your experience with the medication is that people with ADHD, these medications are not stimulating. They calm you down, they slow you down, they clear your thoughts, where your thoughts are spoiling and stuff like that. And most people with ADHD are so sleep deprived that they're able to nap just fine. Once you've proven to yourself that a stimulant is going to help you to sleep, you can take a dose of medication so you can absolute best with life, get in bed and actually sleep. Sounds wacky, but it's what works. And so that's why, but it sounds so wacky to take stimulant for sleep with. That's why I ask people to take that no risk trial name. Prove to yourself, don't take my word for it. Prove to yourself that you'll sleep much better on an ADHD medication than off. Treat falls of your insomnia. Because let's say sleep deprivation looks for the world exactly like ADHD. And it basically just doubles down. It makes it twice as worse, twice as bad. And give that a try. You may have to talk to your prescriber into giving you another dose, but the vast majority of people need 2 extended-release doses of medication to get through the very long functional days and get sleep.
So,
So,
I
so
mean,
take concerted sleep.
Yes.
I'm not sure where you're from, but think about all the different tropes that are out there about people with ADHD being able to immediately take a nap after drinking 3 Monster energy drinks, right? Or drinking coffee throughout the day and still being able to knock themselves out. I take dexylphenidate. I think I'm probably butchering the shit out of that name, which is not important.
Oakland.
Yeah, so I take
Oakland.
I take a small dose of that about 6 p.m. and then I'm usually in bed and asleep by midnight. And like this is a weird thing that a lot of people are starting to realize. Also, I'm going to subscribe to a fun theory that's out there called the night watchman theory for people with ADHD. It is like a theory that like Tom Hartman and a couple of others have kind of thrown out there for fun and shits and giggles. But it's like people with ADHD naturally are late night, anywhere from 1 to 2 hours, but that's an intentional evolutionary thing because they were the night watchmen, they were the warriors and the hunters and stuff like that for their people. And so that has passed down, and sometimes that's where a lot of that comes from. There's a fun article about in Attitude magazine about it. There's not a whole lot of science behind this, by the way. It's just a fun theory.
Well, the other thing, just to affirm what Maine is talking about, I always ask my patients, what is it about your experience of ADHD that bothers you the most, that impairs you the most, that you most want to get rid of? And 25% of people say, my sleep. My sleep is just kicking my ass. I can't sleep at night. I'm constantly tired. My brain's foggy the next morning because I'm sleep deprived, etc. So, your description of what you're going through is exceedingly common, and it's shared by, and again, that it's the worst part of my ADHD. It's shared by 1 out of 4 people. So it's exceedingly common.
So I'm actually on a journey to try and shift my circadian rhythm to wake up around 5 in the morning. It's been the story of my life. I've been trying. Now, is that in vain? I mean, should I stop trying to restart?
Yeah, but it's that. That's the sleep disturbance of ADHD. When you say chronic delayed sleep phase syndrome, people with ADHD want to sleep a nice normal 8-hour sleep phase. It's just the brain and body wants to do it from about 4 or 5 in the morning till about noon. When you get in bed at 4, you can fall right asleep, sleep soundly till noon, wake up refreshed and ready to go. The problem is that there are just very few schools, jobs, or relationships that tolerate that schedule. And you'll find a lot of people with ADHD who will fortunately take night job, go to an emergency room at 3 in the morning. 2/3 of the patients and 2/3 of the staff will have ADHD. People with ADHD you're hardwired to be night owls
Yeah.
and treat the ADHD. Don't just try to suppress the symptom. ADHD is how you're wired 24 hours a day. It doesn't ship out at 5 and say, see you tomorrow morning. Different impairments at different times during the day. And that's what you've been running into your entire life. It has, believe it or not, a fairly simple solution. If taking a stimulant dose at bedtime, now your thoughts are still bouncing all over the place, you should consider adding in an alpha agonist, which is also an FDA-approved ADHD medication. This directed at the hyperactive component of ADHD.
Alpha what, sorry?
Alpha agonists, there are two of them, clonidine and guanfacine. They are, if stimulants help with the performance and attention part of ADHD, the alpha agonists help with the hyperactivity and impulsivity aspects of ADHD. And I go into that in much more detail in the very first video of this series.
Yeah.
So
And
just to clarify, so are you recommending that I take 2 separate doses of the concerta, a lower one for evening,
Yeah.
essentially?
Yeah, the stimulants, they work, they leave, and you're back to being where they start. They treat discrete episodes of life. And so most of them last only 8 to 10 hours. Well, your working day is at least 14 hours. And when you have sleep disturbance, it's already 24 hours. So, the vast majority of people end up taking 2 extended release doses a day because they need it, to fight the implements of ADHD. Dr.
Right.
Tom Brown, who's one of the great thinkers in the field, his most recent article was a huge poll they did out in California of the perceived needs of adults with ADHD. We got what we got. What do we need now? And by far, the biggest need was getting enough medication to cover the entire waking day. That was by far the biggest perceived need of the 160 people that were in the study. It's an extremely common problem. Getting enough medication to really cover the times that you need. So,
Wow, thank you so much.
yeah,
That's something new.
yeah, like what he's talking about is something that I have to do. And also you had mentioned emotional dysregulation and things like that. We may need an additional mood stabilizer or emotional dysregulation medication. Clonidine, guanfacine can work. I take Lamictal or lamotrigine because my anxiety gets so bad that I'll spend 2 hours thinking about horrific things that may be happening. And my doctor said, we're going to get you on this and see if we can get that stuff to go down. Right. And that's what we mean about medication being that journey of finding the right combination that works best for you. And like Dr. Dodson said, it takes time.
Yeah.
And it takes making sure that you're working with a professional who understands ADHD.
yeah. And the other thing is, medications do not change you. What they do is they get the impairments out of your way so that you can lead your fullest life. They should not change your personality. They should not have side effects if you're not knows how to manage these medications.
The reason I am on Zolpidem is because previously I was on melatonin, and that didn't have any effect on me.
It's not a melatonin problem.
Yeah. It's an ADHD problem.
Yeah, it's an ADHD problem. It's not a circadian rhythm problem.
Yeah, and melatonin is primarily for melatonin deficiencies that a lot of people do have due to poor diet, obesity, Caucasian actually, but also, there's just a large number of different ways that melatonin can be used, and for some people it works, and for some people it don't. It sounds like you're the latter.
It doesn't work for at least 2/3 of people.
Yeah. Andy, you had a question.
Yeah, on the subject of medication. So up to 3 months ago, my former psychiatrist had me taking Adderall, 60 milligram, extended release per day, and then a 30 milligram kicker and atomoxetine. And then on top of that, I also take Effexor for depression and anxiety. You know, and I understand about the danger of a serotonin storm when you're mixing SSRIs and SNRIs, but my psychiatrist left the practice, and I got another one who was supposedly well trained in ADHD, and she cut me back to 30 milligrams of Adderall a day and my Effexor. She said I was over medicated. I was doing fine. I was doing really well, and I tried to explain that to her, and she said, "No, you're not. You're not doing fine." I'm currently working on getting a second opinion on that from a doctor from a different practice, but how do you how do you advocate for yourself with your doctor? Or, you know, you have to switch doctors, and now all of a sudden they want to reinvent the wheel and fix that which was not broken. That's my main question, is what's the best way to advocate for yourself?
If you find a doctor reading the physician's desk reference and not you, you need to move on. Your doctor is hearing what you say and on the basis of absolutely nothing telling you that you're real. This is not a doctor that you want. Because if she does this with ADHD, she's going to do it with everything. I'm sorry, this is a bad doctor. So now let's say that you have somebody who actually listens to you. What you can do is say, well, let me tell you my history. I didn't just jump to this. We went up gradually, and with each increase in dose, I had an increase in my performance and my mood control. Everything got better, and I had no side effects. My blood pressure didn't change. The diastolic blood pressure, the second number in blood pressure, is extremely sensitive to the dose of stimulant being too high. It's very specific to the ADHD medications. So if you can show that your baseline diastolic pressure and your pressure on 30 milligrams of Adderall XR are exactly the same, you have shown that this medication is having no effect whatsoever on your cardiovascular system. It's a very objective thing. The dose is not too high. So, and the second thing is, well, you have to say, look, if we're going to work together, you're going to have to listen to me. You're going to have to listen to the feedback I give you. If you're not, then you're treating your imagination and not me. One last thing, the FDA put in the PDR to enhance that amphetamine get on with an SSRI rise and produce a serotonin syndrome. Put in as a caution. It's bullshit. It's something that they theoretically thought could happen, but there has never once at any time, any place, any language been a report of that happening. So it's again, the FDA tends to scare itself and do things which are stupid. But this, like mixing amphetamine with an SSRI is nonsense. It has never been.
That's good to know. And man, I'm glad I asked that question.
Yeah.
It was a good one. It was a good one. Bill, and I apologize, Bill, you had asked the question in the chat and I forgot to ask it.
What I'm asked to ask first is, when do you expect your book to be out?
Mid-year.
Okay.
We're in 400 pages and it started industry much shorter. So now comes the hard part.
Yeah.
Looking out some of your children.
Yeah. Yes. The recent questions about sleep is pertinent for me too. I go through phases. I will sleep very soundly for a couple of months. The last couple of weeks. Well, this morning I woke up. I don't know how I went to sleep all right, but I woke up I don't know how early because I just lay there for a while, and I finally looked at the clock, and it was 5 o'clock, and I normally get up at like 7:15, and by that time, my mind, I mean, was going past the speed of sound. Everything I've been going over for the last 80 years, I had a couple of nights before it was there. I just was not sleepy at all until like 4 in the morning. And I finally fell asleep. And then, like I said, I know other times that, and right now I'm not on a stimulant. That I've been working heavily with a therapist because I've got so much baggage, that's built up over the years, and I'm really learning who I am. And that's a lot of things that we got pasted over at all these time years, along with some, childhood issues. And so things are in that aspect are improving so quickly. And I think that's part of what's the sleep problem. But I've been going to community mental health, and I'm seeing a psychiatric nurse practitioner, and I realize he just does not know what he's doing, in terms of ADHD meds. And I've caught him a couple of times, not listening to me and end up prescribing exactly opposite way he said he was going to. So I am going to be looking for a knowledgeable psychiatrist for stimulus.
Yeah.
You do a very good job of describing what the sleep disturbance of ADHD is like.
Yeah.
Your mind is going 1,000 miles an hour, but it's bouncing from one concern and worry to another. For some reason,
Yeah.
it's never nice stuff.
Yeah.
And you're just for a look. And sleep is the question.
And it's interesting, of the 1,000 different things I thought about, none of them were just random things that jumped in. One little thing brought up another one little thing, and and I went from A to Z and back again a couple of times. There's always logical progressions, which is surprising. One thing, though, about the sleep, I have never been able to take a nap, no matter how sleepy I am, tired I am during the day. But that doesn't mean, in fact, I'm surprised I didn't fall asleep during this presentation. I'll do that. But to say I must take a nap, I just cannot, never.
Well, it's a no-risk trial nap on medication. To prove to yourself that a stimulant medication will not keep you awake. In fact, it does the opposite of slowing down your brain and body where you can sleep normally. It's a normal sleep. It's not an induced sleep. All right. Most people with ADHD cannot nap in the afternoon. Forget it. Didn't happen.
Yes.
Bill, like, we talked about this a little bit earlier with Amin and everything. When you start getting on the stimulant with your new doctor and everything, you really need to take some time and really see if that will actually help you, because that's what helped me. And another thing that helped me was I brain dump, right? This is something I learned from my therapist, and a lot of it's due to trauma and my brain jumping on those trauma pieces, and then progression throughout the horrifying details of what what if and what could have been and regret. And I find that actually getting up, taking 10 minutes, pulling out this brain dump notebook that I have next to my bed. It doesn't go anywhere else. It stays right next to my bed. It's got a pin taped to it. And I literally just brain dump whatever is going through my head. And by the time I get past 10 minutes, my brain's done. I essentially just exhaust myself from trying to use my creative center to dump all this out. And it doesn't have to make sense. I don't even write in English, probably. It's like just all scribbles. But it's the creative process of writing that lets me get it out. I know some people
Externalizing.
Externalizing.
I know. And that's probably real true in my case. And I just don't think of doing that, because I have not been journaling as much as I like to. But when I got up this morning afterwards, I did my journaling, and a lot of that got dumped in. So at least I've got some of it out of the brain, and maybe less of it reappeared tonight.
Yeah, this is a little bit different than journaling because there's really no purpose of it other than just externalizing this stuff. If it's something that may be relevant, I remember to take it to my therapist or I take it to my wife,
Yeah.
and like, because if there's something that's really horrific, like PTSD, something like I think about a time I got bullwhipped or something like that, and it just happens to stay in my head. Like, that's the thing I need to take to my therapist. And like, hey, this thing that my uncle did to me that one time, I really need to talk about it, because it will
Okay.
not go away.
Right.
Dave, what do you got?
Yeah. So in the beginning there, because this one was a lot about for like coaching. So in your opinion, do you find ADHD coaching specifically, not necessarily therapy or medication for people who aren't on medication, is ADHD coaching an effective way of helping, is an effective tool that someone with ADHD can use? Is it you see so many, like, because it's an unregulated field, right? Like there's so anyone can call themselves an ADHD coach. What's your thoughts on that? Because you said at the beginning there of like out of the 43, non-medicated things, they're not as effective. Is there any effectiveness in coaching, or is it one of those things that coming back down to the personalized program of life development or lifestyle development?
ADHD coaching is totally different from just general performance coaching, general, business coaching, be your best self and stuff like that. All the techniques are neurotypical and they're not going to help you. So find somebody who at least went through and got a certification as an ADHD coach. It shows that they really have committed some time. Now, the problem is that a lot of the coaching programs are built on executive function deficit theory, that doesn't work. It's never produced a therapy that works. So coaching does work most of the time. It depends on what theoretical orientation of the person is, what their training is. Because again, what I've been talking about today is people with ADHD are not deficit. They are not broken. They are not damaged. The problem is getting access to their tremendous abilities on demand. And so, for instance, executive function deficit theory has never produced a study that shows that more than half of people with ADHD have an executive function deficit. You can't base a whole theory on something that less than half of people has. So I would, as I'm interviewing people to be coaches, well, I would want to know what their theoretical background is, how they approach and what they propose that you do, and judge accordingly. But you're absolutely right. There has not yet been a double-blinded study to show that works on rats. Now, that's always been a big bugbear with ADHD research. Was, even the things that had been able to show minor benefits, when you come back 3 months later, there's no evidence that it ever occurred. So that studies have to be done. It's pretty clear that people with ADHD need somebody else to help them learn how to manage the nervous system. And everybody that's on this webinar has made it this far. You've got lots of strengths. You survived stuff that were broken, most people. Question is, can you get access to it when you need it? You're not broken people. You can look back at your life and see that you've overcome stuff that would have really whipped most people. You have a right to be proud of yourself.
Excellent.
All
Yeah,
right.
thank you.
Yeah. All right. I mean, you had another question.
Thank you. Just a quick caveat. So, Dave, I currently have ADHD coaching, and my coach is absolutely amazing, and I find it instrumental in helping me understand and strategize. I guess it depends on the experience, and if the coach has ADHD themselves, then they understand it a lot more better. So, my question was in relation to what I raised before in regards to the sleep again. So, I've gone up on an appointment with my doctor. which option shall I go for? Shall I ask for, more of zolpidem, or the second option is, shall I ask a second dose of concerta? Or the third option would be, shall I ask for the clonidine or guanfacine instead? Which would be the best route to go down?
First of all, doctors are very simple people. They want to know whether or not something works. They're much more likely to embrace something that you can come in and tell them that it works. So if you're able to come in and say, well, I think that my inability to sleep at night is the hyperactive component of ADHD, and we even tested that out. And so the first time in my life, I was able to take a nap because I was on medication. And I would like for you to give me an extra dose to this next month and see if that's true. We'll do an experiment, but we have every reason to believe it's going to work. Most docs will say, yeah, let's try it for a month.
Would that
if
be
you
at
want
the same dose? Would it? The
at the
second
same dose. Yeah, medications treat discrete episodes of life. Then they work, they leave, and then you take exactly the same dose for the next 8 to 10 hours. There's no cumulative effect. So most people, again, since 90% of people are like you and spend at least 2 hours every night trying to fall asleep, most of the people who figure this out take another dose for functioning in the evening and so that they can sleep normally. Again, you're treating the cause of your insomnia, not just suppressing it. Your doc should warm up to that notion as well.
So that's the first option to ask for. Well, I've got to experiment with that first, I guess. Okay.
And you can't keep absorbing them forever. And the other reason, and I'll be very blunt here, one of the reasons I really push treating the cause is that people will self-medicate with what they have available. And so this is how you see people getting into daily marijuana use, daily alcohol use, in order to shut their brain off and go to bed. So not treating this insomnia was real risk. I mean, if you go talk to your friends who blow dope every day, somebody who drinks half a bottle of wine every night, and ask them why they do that. I'll tell you 9 times out of 10, they'll say, I do that so that I can sleep at night. So it's not whether somebody's going to medicate their insomnia, but how. And I'll tell you that another dose of Concerta is by far the best option. And if that doesn't do it entirely, then consider adding alpha agonist. Well, never seen the two together not work. And again, it's because it's normalizing brain functioning, not because it's putting you to sleep. You'll still be able to get up, drive a car, do well, inject you up the middle of the night, something like that. You're absolutely sharp, which you can't say with any of the other options. So again, talk to your doc about what works for you, and that your nervous system is not a neurotypical nervous system.
So stay away from the zolpidem. That's sort of the.
And Zolpidem works. You just don't use it for very long. You're still going to have this problem the rest of your life.
Yeah.
So Zolpidem is a great drug. It's just you can't use it forever.
Okay, perfect. Thanks so much.
You're buying yourself some time right now.
Yeah.
Mhm.
I mean, we see this in the group a lot. I mean, I'm not sure how new you are to the group. How many times do we see, like, I have to drink, so that I can sleep, or I'm smoking weed so I can pass out. And I mean, that is a common thing. And, we have to really, really be making sure that we are doing the best we can to solve the root cause, right? And once you start solving that, then that'll help you start identifying the other issues that you need to work with a therapist or your coach or somebody else to kind of start figuring it out, or other health issues, right? One of the reasons why a lot of doctors do blood tests and stuff like that is to check for various other issues that could be a cause. Lead poisoning can mimic ADHD symptoms. There's some sort of honestly, lack of sleep, like a severe sleep apnea or something like that, can mimic a lot of ADHD symptoms. And so that we need to know, like, but once you start treating the ADHD, then you may start identifying other issues that can be addressed in different ways. But at least let's knock this one out, right? Because this is literally how our brains are working. That's what they do.
One of my favorite lines from Shakespeare is sleep knits up the raveled sleeve of care. We can handle our lives much better if we've had a decent night's sleep. And if we're sleep deprived, we are already starting the day unraveled. So this is very important. Quality of life, and also to prevent self-medication with things which are much
All right. Well, we're going to call it a day. I really appreciate your time, Dr. Dodson. This has been eye-opening. Please remember, y'all, we've got 2 other videos out there. Please check them out. They're on our YouTube channel. We're also going to email out the links to all of them, or you should have gotten the links to all of them through the Zephy link that you donated to. And we will be sending all the slides out as well in another email coming up. Men's ADHD support group, I mean, they'll be going public next week. They won't go public this week. Okay. But you should have a link. If you signed up at Zephy, you should have a link that shares both of them with a private link to them. All right.
Comment real quick.
Yeah, go ahead, Mark.
Okay, I was definitely more on the listening end of things today, but I just want to say, Dr. Dodson, thank you so much for coming on. You have a quote now that's up on, well, it's going to be up on all of our men's ADHD support group pages, and it's, you have a right to be proud of yourself. And I love that. I think that those of us navigating ADHD, we struggle lots with self-confidence due to some of the reasons you mentioned early on, but this is, I love hearing you speak. It's always extremely informative. I always learn something new from you, and I really appreciate your time.
Thank you. Glad to be here.
Definitely. Also, everybody's going to get a survey request whenever y'all sign up to Zoom. Please feel free to fill it out if you don't want to. Not a big deal. This is for us to have more content to bring to you, so that we can keep doing these webinars, keep providing value to you as a nonprofit organization. And we just want to say,
keep improving the webinars so they really match what you need. We're very open to all feedback.
Yeah, definitely. All right. Love all of y'all. Thank you so much. Thank you, Dr. Dodson. Y'all have a great day.
Okay.